Most people think a medical career only means hospitals, night duties, and lifelong burnout. But what if I told you there is a healthcare career that focuses on prevention, policy, and population impact, and it's growing rapidly in the UK? That career is public health. Hello, everybody. My name is Professor Dr. 𝐘𝐿'. I am working as a Dean and HOD of Department of Community Medicine and Public Health. I have 25 years experience of teaching, research, and career counseling to the students. In this video, I will explain public health careers in the UK, the different roles you can work in, and why more doctors and health professionals are moving away from purely clinical work into this field. Let's begin the video. Public health is an expansion of healthcare, not an escape. A public health career focuses on improving health at population level. Instead of treating one patient at a time, public health professionals use preventive strategy through which a systematic impact came, which prevent disease, improve health systems, shape policies, use data to guide decision, and it gives the professional a sustainable lifestyle. On the other hand, clinicians use reactive care and they focus on individual patient one by one to treat the disease, which makes the lifestyle high stress and lead to ultimately burnouts. In the UK, public health is considered a core pillar of the healthcare system, not a side specialty. Let's discuss the architecture of health, which ensures the healthy population. It begins with the prevention, in the first place, which is used to stop the disease before it starts. Then comes the policy to shape the laws and regulations that dictate national health outcome, and the third most is the data, which help make large-scale and critical healthcare decisions. This approach goes from micro, that is patient, to macro population level to achieve healthy population. Public health offers what many healthcare careers struggle to provide, a true lifestyle dividend. It combines intellectual challenge with predictable schedules, reducing the constant pressure of emergency-based work. Most roles are office-based or hybrid, allowing sustainable routines with less physical exhaustion. Instead of influencing one patient at a time, public health professionals shape policies that impact entire communities. And with strong government backing, the field offers long-term stability and security. For many, this balance is what makes public health a long-term fulfilling career choice. In a nutshell, public health provides us balance in our life, a good environment, influence over the population health, and stability and security in the job. Public health professionals don't work in isolation. They operate within an ecosystem of influence. At the center, public health professionals connecting with the multiple sectors. They work with the government agencies, shaping national health policies and regulation. Within the NHS organization, they guide strategic planning using population level data. Through universities and research institutions, they generate evidence that informs practices. And with the alongside NGOs, they drive targeted intervention for the vulnerable communities. Unlike clinical roles, this work is primarily policy-driven and data-centric. Often, these jobs are based in the office or hybrid, focusing on system, strategy, and long-term impact rather than bedside care. Let's discuss the major public health roles in which you can work in UK. First of all, roles in strategy and science. There are the two key pathways for public health leadership and impact. The one is public health consultant. His function is leads population health programs and makes high-level policy decisions, and the impact which comes as direct influence on community health outcome. The second one is epidemiologist, who studies disease pattern, outbreak, and interpret complex health data, which provides the scientific evidence for health interventions. There are many other roles in the public health. The one in data and policy is health data analyst, who works with large data set to guide healthcare planning and resource allocation. And the second one is policy advisor, who designs and evaluates health policy both at local and national level. Besides this, you can also go into academia and in research, where you can help in teaching, research, and evidence generation. You don't need to be a clinician for all of these roles. Many are open to non-medical background as well. Public health is one of the most future-proof professions in the healthcare. Across the world, populations are aging, demanding long-term system-level management rather than short-term treatment. At the same time, chronic diseases and health inequalities are rising, increasing the overall disease burden. Global health security has become a priority, with pandemics and emerging threats reshaping how countries plan and respond. And finally, healthcare is shifting towards the innovation, using data, analytics, and technology to guide smarter decisions. All of these forces are moving in the same direction. Public health is no longer optional, it's essential. The question rises here, who can enter in the public health field? The UK system values diverse inputs. The pathway is not restricted to those with an MD. Public health in the UK is open to a wide range of backgrounds. Medical graduate and dentists, nurses, and allied health professionals are welcome, but at the same time, graduates of life sciences and social sciences and statistics can also work in the public health field. Another question which need answer is, what should be the profile of the candidate who want to join public health? What matters most is not your title but your mindset. Universities and employers look for your analytical thinking, that is your ability to interpret complex information. And the second one is your systems mindset. This is willingness to work with policy and large scale framework. And the most important one is your prevention focus, your genuine interest in stopping disease before it occurs. Success in this field is defined by your ability to think at a scale, not your clinical skills. What is the public health career pathway in the UK? A typical public health pathway starts with the bachelor degree followed by the master degree such as MPH or MSc. After gaining experiences or training in a research or in a field, professionals move into the public health roles and later progress into leadership, consultancy or academic position. In the UK, public health training is well structured and recognized. In the last few words for those who wanted to join this career, public health is about saving lives at scale. The goal is sustainable, meaningful work that addresses the root causes of illness, not just the symptom. The method relies on strategy, data, and prevention, using evidence to make decisions that protect entire communities. And the result is a career that offers intellectual challenge, real-world impact, and a healthier balance between professional purpose and personal well-being. This is public health. Remember, public health is not an escape from medicine or healthcare. It's an expansion of how we improve health from individual to entire communities. If public health sounds like a path you would like to explore further, subscribe to this channel, that is Research Map. Every week I share clear guidance on public health careers, UK healthcare systems, MPH programs, and research pathways. In the next video, I will explain step by step how medical and non-medical professionals can apply for public health and research programs in the UK. See you in the next video. Up till then, bye-bye.